Welcome to the ProVeneer training webinar. Hi, I'm Dr. Harvey Silverman, and today I'm going to share with you how I create a ProVeneer, as well as lessons I've learned along the way. I also want to know that I am a consultant to Silmet, the company that makes ProVeneer. When you open up your ProVeneer kit, you'll notice the RBFM, that is the resin-based foundation material that creates the ProVeneer, is packaged in unique paquettes. And the manufacturer recommends that you use one paquette to create one ProVeneer. However, let me share a tip with you. ProVeneers are very thin as 1/10 of a millimeter. So you may be able to actually create two ProVeneers for average sized teeth. And another tip is when you use gloves, pull your glove very tight, especially on your pinky finger. And that's because your glove pinky finger is going to adapt the RBFM to the facial surface of the teeth. Therefore, you don't want any ridges in your glove. As you work with the material, you'll see why this is very helpful. And one more helpful tip. I like to roll the RBFM into a ball and place it on the tip of my glove. And please remember, you're creating a very thin yet very durable veneer, so using less RBFM is actually better. Let's start by creating the Smile Preview veneer known as the SPV. The Smile Preview veneer lets you know if your skill set matches your patient's expectations before taking on the case. And that's very, very helpful. And a tip is let your patient watch you create the Smile Preview veneer with a mirror. And here's how to create the Smile Preview veneer. Start by placing the RBFM button on the facial surface near the incisal edge of the tooth. Do not place it in the middle of the facial or by the gum line. Next, move the RBFM halfway towards the cervical with your glove pinky. You'll notice the RBFM moves exactly where you want it and it won't stick to the glove. And this takes only about 15 seconds. It's really very, very easy. Next, drag some of the RBFM onto the incisal edge with your glove pinky. That's to create a positive rest seat. You do not want to wrap it though onto the lingual of the tooth shown in this picture. If any RBFM is on the lingual, you must remove it before you cure it with a light. You need to avoid creating a labial lingual lock or the Smile Preview veneer will fracture when you take it off the tooth. Next, drag some of the RBFM to the cervical of the tooth as you see on the left side of this picture and do this with your gloved pinky as well. Do not use the plastic instrument to create the facial surface. Again, please use your gloved pinky. Where you're going to use the plastic instrument is to remove any excess RBFM by the gum line, and you also can use it to create line angles. Best of all, you'll notice that the RBFM stays in place and it eliminates procedure frustration. Next, light cure the SPV once everything is in place the way you like it. And you may be wondering, where's the mylar strip? These veneers can be as thin as 1/10 of a millimeter, so if you have a separating saw, it just may not be necessary. However, if the SPV is thicker than 3/10 of a millimeter, you really should be using a mylar strip. By the way, even at 1/10 of a millimeter, the veneers are very strong. When you take it off the tooth, hold it at the cervical and flex it, and you'll notice it doesn't break. Now, in my hands, this process really simplifies finishing and polishing, which is so important today. And as I mentioned before, I found one of the key steps is to remove the excess RBFM before curing it, which you see me doing on tooth number 7. And please note, tooth number 8 and 9 that already have Smile Preview veneers were light cured before moving on to tooth number 7. But you can see you create this beautiful seamless emergence profile. And if you look at number 8 and 9 alone, how much finishing and polishing do you think is going to be necessary compared to doing conventional composites? And once all this is in place, and go ahead and cure it with a light. But you want to make sure that you avoid wrapping the RBFM into the interproximal to prevent fracturing upon removal, and you want no undercuts. Now the patient has an opportunity to rate the Smile Preview veneer. Simply hand the patient a mirror and ask, how do you rate the change? On a scale of 1 to 10, 10 being you love it and 1 being that you hate it. And if the patient gives you a rating of 8, 9, or 10, that qualifies the patient as a really good candidate. However, anything below a 7 would disqualify the patient because you wouldn't want to take on a case where the patient basically is saying your skill set doesn't match their expectations. Now you can remove the small preview veneer with a scaler after the rating is done and show the patient what the small preview veneer looks like and share with them how translucent it is, that this is what helps create that natural looking appearance that they want to have. And also show them how thin yet durable it is. You can hold the small preview veneer by the cervical and try to flex it and you'll see it won't break. Assuming the patient's given you a high rating on your small preview veneer, now it's time to do the lab processing to enhance the physical properties. And here's how you're going to do that. You're going to place the small preview veneers in a microwave safe cup. You're going to fill it with distilled water halfway to 3/4 of the way and place the cup in a microwave oven, heat it for 3 to 4 minutes under high power, and carefully then remove the ProVeneer after 3 to 4 minutes. And if you're going to be using a micro etcher or a sandblaster, be very careful not to perforate the veneer because it's so thin. So literally sandblast for a second or two, that's it. Now let's review clinical steps for cementation. The dental assistant starts by taking out the etchant that comes in the ProVeneer kit, applies it to the inner surface of the ProVeneer, and then after 30 to 60 seconds rinses it with copious amounts of water. Now, dry the inner surface of the ProVeneer with a gentle stream of air and apply a thin layer of the ProVeneer bonding agent that comes in the kit, and then remove any excess with a gentle stream of air. Do not cure the bonding agent. At the same time, you also can be applying the etchant to the enamel of the teeth and then rinsing it off with water, applying the ProVeneer bonding agent directly to the tooth, and then blowing off any excess with the air syringe so you only have a thin amount of bonding agent on the tooth. And again, do not cure the bonding agent. Now apply a very thin layer of cement that comes in the kit, and this way you won't have a shade shift. And remember, your ProVeneer is custom made, so use very, very little cement. Now this next step is critical. It's very important. The ProVeneer is very thin, so you have to use very gentle seating pressure. And you really want to use your pinky to do that. Otherwise, you can fracture it if you're using your thumb or your index finger. And you can see that's what I'm doing in this top picture. I'm using my gloved pinky finger. Once it's seated, now you're going to go ahead and cure the veneer. With ProVeneer, you're going to find finishing and polishing is so easy. And you're going to start with a medium grit polishing disc using very light pressure. Next, use a fine polishing disc with water, again with light pressure. And then check the occlusion and adjust the bite accordingly. And finally, check to confirm you have a seamless emergence profile. Note the lack of tissue irritation as we're doing finishing and polishing, as well as the high polish we're able to accomplish. And in this final photo, you're going to see the seamless emergence profile, and that we're able to do essentially 4 ProVeneers in about 1 hour, including the lab phase. Now let's talk about the role of the small preview veneer in terms of how it benefits your patient. Basically, it allows your patient to know what your skill set is. It's a way for you to inform, educate, and motivate your patient. So when a patient comes in with a dental problem like this and you discuss ortho and the patient says, no, I really would like to see what's possible with instant smile transformation, this is how you're able to share with your patient what the realistic transformation will look like. It shares what is possible without patience. So even when a patient comes in with subtle problems like this patient, and she didn't like the appearance of her eye teeth, and we were able to do a demonstration with a small preview veneer where we just had to do 2 teeth, the lateral incisors, and she's watching with a mirror, she became very enthusiastic after this was completed. Another benefit from a patient point of view about ProVeneer is that it's reversible because it causes no damage to the tooth. And here's another tip. If you'd like to find out what your patient wants when it comes to cosmetic dentistry, have the patient co-diagnose with you. And when a patient has a subtle issue like this, what do? Well, my suggestion is have your receptionist update the patient records with a ProVeneer dental history update form, and this basically starts a dialogue. So we found out that this patient wanted to have two small preview veneers placed on number 7 and number 10, and you can see how they blend in seamlessly with the adjacent teeth. This is really doing what I like to call bread and butter cosmetic dentistry. That's one of the additional benefits of the ProVeneer system. Some dentists have wondered, why was ProVeneer developed? Well, it was developed to service that large segment of our patients who cannot afford porcelain veneers but are still eager to have a nicer smile. As demonstrated in this testimonial letter written to Dr. Gary Bronstein in San Diego, and you're going to find over time that ProVeneer is going to really truly benefit not only your practice but most importantly the patients that we treat. Now let me share with you some additional tips that I hope you find helpful. Let's start with, how do you find patients in your practice who can benefit with ProVeneers? This patient on the left side had tooth number 7 that she wasn't pleased with the appearance with. However, we didn't know that. After giving her the dental history update form, we were able to determine that she was unhappy with one of her teeth, and as you can see from the small preview veneer, it blended in beautifully with the adjacent teeth, and she decided to have work done. Another lesson learned is from this before and after case sent to me from a dentist that I trained, and he said she loved it. I broke the first one though, getting it off with a scaler. It really was easy to use, and yes, the pinky is the way to go. So what's the lesson learned over here? I had mentioned before that you need to check the lingual before curing the small preview veneer, and if there's any RBFM on the lingual, then you must remove it before curing it with a light, or it will fracture when you try to remove it. Another lesson was that the dentist learned that using his pinky and not his index finger was the way to go when you want to facilitate placing a beautiful small preview veneer on the teeth. Another helpful tip is how to remove the smile preview veneers. When this patient came in, we did 4 smile preview veneers, and when I went to remove it, you can see that number 8 and 9 came off as one unit. This is easy to avoid. Simply floss before removing it, and if the floss does not go through, use a separating saw, and then when you remove it with your scaler, it will all come off as individual units. Also, before doing a small preview veneer on a patient, please check for bruxism and carefully evaluate lateral and protrusive excursion movements. If you see an interference, you need to address that so that you'll be able to have long-lasting, durable results and avoid chipping. And that's exactly what I did, as you can see in this particular case. I think over time you're going to see that ProVeneers are going to help redefine what a smile makeover is, because now we can do just 1 or 2 ProVeneers and whitening and literally give patients the smile that they've always wanted to have, and it's going to greatly benefit our patients. Another example is this patient who came in to see me, and she came in for a second opinion. And she had gone to another dentist who wanted to do tooth preparation and porcelain veneers on about 8 to 10 teeth, and it was going to be very expensive. So she said, let me think about it, which basically meant thanks, but no thanks. So we did small preview veneers, and we said, sometimes the best cosmetic dentistry can actually be the least amount of cosmetic dentistry. And with just placing 2 small preview veneers on number 8 and 9 and doing some teeth whitening, we were able to give her the smile that she always wanted, and we were able to rejuvenate her smile by, 5 years or so, and she was a very, very happy patient as a result of ProVeneers. A final case I'd like to share with you is this patient who came in and we told her she needed to have an ortho consult. And she said no, she previously had ortho and she didn't want to have ortho again. So we went ahead and we did 3 smile preview veneers just to see what was possible. Here's what she had to say about this.
But when I look in the mirror, I see a smile that looks like I've always had this smile, that it's natural, that it's not fake, that it's me. I like the smile preview because it wasn't computer generated. It was actual veneers that were put on my teeth so that I can see what my smile was going to look like in the end before I even began.
ProVeneer doesn't only solve patient problems, it solves dentist problems as well, as this letter demonstrates. The dentist wrote to me, I do composite veneers, but I have to allow an hour per tooth, and in the end I actually lose money doing them. They're stressful, and I've come to actually hate doing them. Can you help me? And also, can you help me cut not only on my time, but he wants to know how to avoid porosity, as it never fails to happen that I'm almost finished and I polish into a bubble in the composite. Well, this will not happen with ProVeneers. Here's what your colleagues are saying about ProVeneer. It's the most phenomenal material I ever used in 35 years. It's much easier than PLVs or bonding. It's building my reputation as the best cosmetic dentist in the area, and I feel like we found a little diamond. Finally, here are a few last items I'd like to share with you. If you should have any questions, here's my contact information with my phone number, email address, and website. And for additional kits or products, please contact dentaldealsonline.com, and here's their phone number. I would like to thank you for your time, and please feel free to stay in contact with me. I look forward to hearing from you.